What's up everybody, Dr. Zach Baker of R2P and doing another recap of how I spent my Tuesday with some of our clinical staff. This past week was down in our Montgomery County locations, Bethesda in the morning, Germantown in the afternoon, and one of the cases that I got to sit in with one of our newer PTs was a preoperative ACL case. So with this individual, they had already been coming to PT for several weeks, they already have surgery lined up, and surgery is actually in a couple days. So this was the final session prior to going in for the operation. We've already got the post-operative appointments lined up. So it was a pretty cool one to sit in on because I got to see an actual treatment session of what they were doing that day and a description of what they were doing in the preceding sessions leading up to it. And to my understanding, talking with the clinician, preoperative rehab was prescribed because the individual came in immediately after the injury and they were working on symptom reduction, getting pain levels down, getting swelling down, restoring range of motion and just a normalized gait pattern. And as they were doing that, the patient was also meeting with the orthopedic, confirming via imaging what the actual injury was. They deemed it to be an ACL tear. They went ahead and scheduled surgery for the first available date in the future. But the orthopedic wanted them to continue with PT to maintain conditioning levels as well as possible, restore range of motion, and get them as strong as possible leading up to the surgery. I think one of the coolest things I got from that session was the patient actually said to the PT, I don't feel like I need surgery. I feel like I can run. I feel like I can do everything I need to. And he's fully aware that surgery is the best thing for him. But he kind of expressed that confidence of like 2 or 3 weeks ago, I would have never said that. But the knee feels good. I'm walking around. I have that inclination when I see a flight of steps that I just want to cruise up and jog up them instead of being a little bit more tentative with it. So I think I would call that a successful rehab process. What we ended up doing in that session was getting some baseline measurements going into surgery. So we looked at circumferential measurements of the leg at the knee, at the mid-calf, at the mid-thigh. We got some updated Tyndek measurements just to have some sort of reference for after the surgery. We did that for knee extension and knee flexion. We also did an anterior step-down test as well for the individual. Got some goniometric measurements on both limbs going into the surgery for knee extension and flexion. And then the remainder of the time, we just continued the workouts that he was doing leading up to the surgery, which was largely based on a variety of strength training activities, some isolated to just single joint, single plane motions for knee extension, knee flexion, try to maximize quad and hamstring strength going into it. But then a lot of the rest of it looked like just a well-balanced strength training program. Some bilateral movements, your traditional squatting and hinging activities, some bilateral asymmetrical tasks like a split squat or rear foot elevated split squat, and then a couple different single leg activities sprinkled into the mix to get some stability, some balance, some proprioception as well. And then also a little bit of just light conditioning on the bike as well. So that was a fun one to sit in on. Look forward to see how the surgery goes for him. He's a local kid who is a college basketball player. So he'll be a fun one to follow along with his journey afterwards and see where he goes.